Hello, this is Dr. Rhonda Johnson. Today is Thursday, April 21st, 2022, and today I'm talking about Omicron infection in children. So I'm going to report summaries of several published scientific reports. The first summary was published in the Journal of the American Medical Association Pediatrics Journal on April 1st. Records were reviewed from September to late January, and the researchers found that the incident rate of Omicron infection was higher in children between the ages of 0 to 2 than in those ages 3 to 4 years of age. The results also showed that the incidence rate of infection with Omicron variant was 6 to 8 times that of the Delta variant in children younger than 5, but severe clinical outcomes were less frequent with Omicron than with the Delta variant. The second study was published by the CDC on April 19th in their weekly morbidity and mortality report. This study looked at 400 pediatric hospitalizations from mid-December to the end of February during the original Omicron surge in the United States, and this study found that 9 out of 10 hospitalized children were unvaccinated. 3 out of 10 hospitalized children were healthy with no underlying conditions, and Black children represented the largest group of unvaccinated children, followed by white and Hispanic children. And children with diabetes and obesity were more likely to experience severe COVID-19 infection than children who didn't have diabetes and obesity. Now, the third study I wish to report was published by the Canadian Medical Association Journal in April also, and they looked at household transmission of COVID during the original first wave infection. And they found that children were an important source of spread within families. And so household transmission was nearly 50% in this study. So again, even though this did not look at Omicron, knowing highly transmissible Omicron infection is, we can conclude that children remain an important driver of the COVID-19 pandemic, although their illness may be milder than other family members. So why is this important? Why do I think it's important? Well, because I think, again, we need to encourage all parents of children 5 to 11 years to talk to their healthcare providers and get their children vaccinated. And we know that parents of children under 5 years of age are going to have to make some decisions around COVID vaccination if the CDC and the FDA approve these vaccines. Knowing how effective Omicron is in very young children may help inform their decision. So that's my message today. As always, my views are my own. Take care.